Good evening, everyone. Yesterday, I told you that we can divide whole spine in three parts: upper part of the spine, middle part of the spine, and the lower part of the spine. Upper part of the spine treating the upper body, like the problem of the head, migraine, chest, lung, and heart problem. The middle part of the spine treating the digestive disorder, and the lower part of the spine treating the problem happening in the lower part. Remember? Everyone remember that? So I think my model is visible to you, right? Fine. So we are using different type of cup. This is the silicone cup. This is the rubber cup. And these are the very, very smaller cups. So we can use different type of cup. So we can do the dry cupping. If we want to do the dry cupping, so just put the cup here. Put the cup here. We can see this cup already sticked very nicely. And leave the cup here for 1 to 3 minutes. So what is happening exactly here? What is happening? Like if I squeeze the skin like this, you can see this part become red. Why this part become red? Because of increasing the circulation in this part. Now, if you see this part has become red. So what happened exactly here? So when I am putting the cup, there is a pulling over the skin, pulling over the muscle. So pulling over the skin, pulling over the muscle, and the most important thing, on the surface of skin, we are having some meridian that is called Leo meridian. So ultimately, we are pulling the Leo meridian. So if we divide the whole spine in three parts: upper part, middle part, and the lower part. So this upper part treating the pathology happening in the upper body, the middle part treating the pathology happening in the middle body, and the lower part treating the pathology happening in the lower body. So someone is suffering with the digestive disorder. So we will see, this is the bone. The name of this bone is scapula bone. We can see this is the lower boundary. So this is the lower boundary of the bone. So this is the ending of upper part. And now from here, this is the lower part, and the lower part till the ribs, till the area of ribs. So this is the middle part. So if someone is suffering with the digestive disorder, just put the cup simply. And just put the cup simply here and just leave them for 1 to 3 minutes. And in this way, we can improve tremendous circulation in this part. Now, whether be just stimulating, just igniting the circulation, just improving the circulation, so answer is no. We are also removing the blockages. If any blockage is here, suppose if someone is having that pain in this part since many months or many weeks, even this cupping will help to release the pain. In the same way, if we see the ribs, so this is the lower part of the ribs. We can see this is the lower part of the ribs. So this is the rib ending part. So this is the ending of middle part. So this is the middle part. So now this is the lower part, And if we do the cupping here, this cupping is very good for low back pain, buttock pain, knee pain, ankle pain, swelling in the lower part, and there is a weakness in the lower part. So for this purpose, we can do cupping here. And leave the cup for 1 to 3 minutes. So even in this way, we are doing cupping in the body. But right now, I'm telling you about the spine so that we can learn a very good thing in very minimum time. But we also do the cupping in the different part of the body. And if you do the cupping on the knee, it will work on the head region. So in this way, body is very deeply interconnected. You are doing cupping somewhere and it is releasing the pain of somewhere else. So now if I'm removing this cup, you can see there is no pain at all, but this part become red because there is an increased blood circulation, and this is there is no any harm of this cupping. It is a very simple method. So in this way, for the upper problem, we can do the cupping in the upper body, upper part of the spine. For the middle body, we can do the cupping in the middle part of the spine. For the lower body problem, we can do the cupping in the lower part of the spine. Now, these are the simple cups. Okay, these are the vacuum rubber cup. If we just press them and leave them, they are sticking. See, very nicely they are sticking with the skin, and even anyone can do, even a small kids can do this cupping. See, there's a mark here. So even this cupping is very helpful. Suppose someone is suffering with a cough and cold, then what is the treatment? So if any kids is suffering with a cough and cold, what treatment we are doing? So this is the upper part, and this upper part is connected with the upper body, even with the lungs and heart. So we'll take any oil. Suppose we have taken little coconut oil. So this is the little coconut oil. And we will spread this oil on the both sides of the spine evenly. We will go near about 3 finger this side and will spread the oil, and 3 finger this side and will spread the oil. Now this is the spine. On the both sides of the spine, we will do just up and down massage. I am doing treatment of the lung disorder, cough and cold, asthma. Even this method is very effective for the patient who is suffering with the asthma. So I will do this stimulation for 1 minute. If someone is having the attack of asthma, you can do this. Or you can stimulate with the thumb. With the thumb, you can create more pressure. You can do as per the comfort of the patient. Because both sides of the spine means it is the remote points, they are control of whole body. So we have done this, right? So we have done this. So in the both sides of the spine, if we are doing acupressure, this is the very good for lungs. Okay, now if we want to do little more, then taking the small cup and just putting on both the side of the spine, right? And putting and removing, going down. In this way, we can enhance the power of the lung, the chi of the lung, and we can strengthen the lungs. It's a very simple method. And there is no risk at all. Just do one by one in the sequence. You can see. So you can see there are lots of red mark here, but even there are lots of red mark, but it is not creating pain. Okay, it is very Like even when patient are looking in the mirror, then only he will realize that he has got some mark here. Otherwise, there is no pain at all, or very, very lesser sensation. And this mark will disappear within 2 to 7 days. Some person having very highly sensitive skin, so this mark will take little more days. But when these mark will disappear, this skin become more brighter. This skin become brighter than the earlier because of more blood circulation here, right? Even we can do the cupping massage here. So for the cupping massage, we have to put little oil. We have taken the coconut oil, which is very easily available everywhere. And we can do that. We can spread the coconut oil evenly, very properly. Now we'll put the cup bilateral on both sides. And just we do the cupping massage. See, this is the cupping massage. We are pulling the cup together, right? This is the cupping massage. Excellent for the pain. If someone is having pain in this part, this method is excellent. And even for the asthma. Even we can do in the central, because central part is still left. This is a wonderful cupping massage. So we can do even little away from the spine, because this upper whole part is very good for lungs. So the person is going to feel very good effect post cupping. Okay. So now you can see there is a very good circulation in this part. So when we can see the redness, so this is a very good stimulation. We have not used a single needle, but this is a greater stimulation than the needle. So in this way, this cupping method is painless, very smooth process. There is no risk if you do it, right? And even patient feel very comfortable. And very excellent method if you want to release the pain. So just we have done in the upper part, right? So initially we targeted the lungs. Now suppose for every disease we have different protocols. Now I would like to tell you one more protocol here. So before telling to protocol, suppose if you just want to do with the rubber cup, put the rubber cup, and even rubber cup can be glide downward. See, wonderfully going down. Wow, wonderfully going down. See, still they are sticked. So we can do with the rubber cupping, and you can do to small kids in your home if they are suffering with the cough and cold. Even you can do for the person who is sitting throughout the day and having the pain in the upper back. And after doing this, the person are going to feel very good effect in the upper back pain. So suppose someone is suffering with a cardiac problem, heart problem, and it's very challenging, then what to do? Whether we have something here which can release the cardiac pain very fast, immediately, just in one sitting. So answer is yes. So what do we do here to release the cardiac pain immediately? I will tell you now. So number one, the same method we have to repeat from top to bottom. If the same method we repeat in the upper part, means from this part, top to bottom means only in the upper part, then definitely it is going to work in the upper body. The upper body means head and chest. So this is going to work for heart as well. And the point number two, we have one very specific area for the heart. So now I will tell you. We know this is the right side and this is the left side. And heart is located on the left side. So when we are pressing here and here, person will not be having much pain on the right side, but person will be having much pain on the left side. If the person is suffering with the heart problem, with the cardiac problem, and if we press here, the person will be having more pain. Even if you press here on the neck, So the person will be having more pain in the left side. So left side will become more sensitive for the patient who is suffering with the heart problem. So now, suppose the patient is having heart condition and I want to do cupping for this purpose. And I have to release the heart pain instantly, immediately. And definitely person is going to feel very good. So then I am searching the bone here. This is the one bone and this is the another bone. The name of this bone is scapula bone. See, this is bone, scapula bone. The secret of the heart disease are in this scapula bone. And this is also the scapula. Just you have to treat the border of scapula bone and the heart pain will go away instantly. And if you want to see, if anyone telling you about the heart condition, just you press the border of the scapula, the patient will shout, the patient will cry, oh doctor, leave me, too much pain. Now, the same pressure you will give to the right side, patient will tell you, oh, no pain at all here. There is no pain in the right side, but when you press this border, the border of this scapula bone, the patient will be suffering with the tremendous pain. So what we have to do, if the patient is having cardiac condition, we will take few drop of the coconut oil and will spread this coconut oil evenly on the border of this scapula bone. Just on the border of scapula bone. From top, this is the top trapezius muscle, and this is the side, this is also the trapezius muscle, and we are following the border of the scapula bone until the axilla, till the line of axilla, right? So now we will start from here. First, we will put one cup here. Okay. So before putting the cup, we will do the gentle massage here. 1, 2, 3, only 7 times. Enough. 4, 5, 6, and 7, and put the cup here. So let it be there for 30 seconds. Sometimes patient is telling, oh, this cup is painful. Otherwise, this cup is not painful. But if the patient is having heart condition, this muscle pulling also not be comfortable for the patient. Okay, so removing after 30 seconds to 1 minute. Now, we are searching the border of the scapula bone. Now we are doing very gentle massage step by step. 1, 2, 3. This is the acupressure massage. 2, 3. Then going forward. 1, 2, 3. 1, 2, 3. 1, 2, 3. 3 stroke 3 times. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 3, 1, 2, 3. So keep on going. Still, we have not completed till the line of axilla. This will be very painful. So we have to do the pressure as per comfort. Done. Now put the cup on the borderline. 1, 2, 3, 4, 5. In this way, we have to put the cup here, right? Let it be there for 30 seconds to 1 minute, or if possible, even for 3 minutes. So by putting this cup, there will be lots of blood circulation will get improved. Now we are pulling the muscle, and heart is also made by muscle. Heart is not the bone. Heart is just a muscle. Heart is pumping throughout the day and it is made by muscle. And after that, we will remove the cup and treatment is over. Person will get very good relief immediately. And after 30 minutes to 1 hour, person will tell you, wow, I'm much relaxed. The heart pain gone. In the same way, we have point of liver, we have point of kidney, we have point of each and every part. So we are going to discuss them step by step, one by one. In the same way, we have point of the migraine headache. Okay. So for each and every problem, we have point, right? So now yesterday I was telling you that if we want to make our body immunity in the very good condition, if we want to make our defense system very good, right, then what to do? Who is providing immunity? Who is making your defense system stronger? So the answer is yang. Okay. 1 minute. So yesterday we were talking about that who is making your defense system stronger, yin or yang? So answer is yang. Yeah, we know that. Yang is like a bodyguard. And yang means heat of the body, yang means circulation of the body. So for that purpose, if we want to increase the heat, if we want to increase the fire, if we want to increase the yang, then we are using Moxa. Moxa, right? This is the Moxa stick. What is this? I am just going to explain you shortly. First, I will do you demo. After doing the demo, I will explain you that what is that exactly? What is inside of that, right? So let me ignite this Moxa. So look at this. After igniting, this become like this. We are igniting it like a cigarette. Now, we will do the Moxa on 3 point. I'm going to demonstrate you the doing Moxa on 3 point. Why? Because by doing the Moxa on 3 point, we can improve our immunity. During the COVID pandemic, We have told these points to many persons and they have got very good benefit. So the first point is CV6. I will demonstrate you. So shall I give you demo? How to do Moxa? Okay. Would you like to see the Moxa? Okay. So we have already ignited the Moxa. Now, yesterday I told you from the navel, if we go 2 finger down. So this is the point. CV6. This CV6 is the great generator who produces lots of heat and electricity. And this single point is producing lots of energy and the yang energy. And we are also telling this point as a vitamin point. Suppose someone is suffering with the deficiency of the vitamin, then we can use this point. So when we are doing moxibustion, we are keeping this moxa 1 inch up, neural 1 inch up. We are not touching with the skin. And we are taking the support of our hand and then we do the moxibustion like this. Okay. Just we are rotating it clockwise and we are telling to the patient, if patient is feeling more heat, he will tell something like whom. Whom means we have to reduce the heat. So how to reduce the heat? If patient is telling whom, we will keep it away, then bring back. We have to do it here minimum for 1 minute or 3 minutes. And with the help of Moxa stand, we can do for 15 minutes. What is Moxa stand? I will show you in the upcoming class. We are just placing the Moxa box here and we can holding this Moxa in the Moxa stand. So after doing 1 to 3 minutes here, this is the location of CV6. Now, if I touch this point, this is very hot. So this point is located 2 finger down from the navel, or we are telling 1.5 tune down from the navel. Okay, so there's a 2 finger down or 1.5 tune down from the navel. Now from the navel, we have to search one more point. Now look at this is the chest bone. And see where chest bone is ending, or the other name of this bone is sternum bone. This is the sternum bone. This is the ending here. So we'll search one point just in between the ending and this navel. So this is the midpoint. This midpoint is the second point who improve yang, who improve immunity. So we are doing moxibustion here. This is the second point. So I'm keeping this, I'm taking the support of my hand here. Then I am doing the moxa here. I will do here for 1 to 3 minutes. And with the moxa stand, we can even do for 15 minutes. Just do the moxibustion here and here. Just these 2 points and plus 1 more point, in total 3 points. You do this moxibustion and ask the person, he will tell you, I'm feeling much energetic. So these 2 points plus 1 more point are pumping the energy in the body. घुटने को फोल्ड करो, थोड़ा पीछे से रख जाओ, इसको फोल्ड करो, थोड़ा और ऊपर, नहीं आगा, चलो कोई बात नहीं, ऐसे लेट जाओ, नहीं बैठ जाओ, सर पीछे से, नाउ और थोड़ा ऊपर, और ऊपर हल्का सा, बस हाँ. So this is the knee. Fold them, घुटना fold करो. Yeah, वो वाला घुटना fold. So look at this is the knee. And we can see the depression of the knee is here. So this is the depression of the knee. So from this depression, so this is the knee joint. And there's the depression. From this depression, if I go forefinger down, this is called forefinger down or the three chun down. So this is my next point. We have to remove the cloth, then we have to do. Right now, I'm just doing the demonstration. So we have to do here. So we can feel the bone here, one bone. This is just next to bone and forefinger down. This is the third point and it is called stomach 36. And it's also a very good point for improving the energy, enthusiasm. The other name of this point is steroid point because it is improving too much enthusiasm. So we are doing moxibustion here. Right? So in this way, so this was the quick demo of cupping and moxibustion. So whether we talk about the cupping or we talk about the moxibustion, both are very smooth procedure, very, very smooth. No one is a aggressive procedure, neither the cupping nor the moxibustion. And both are very highly effective procedure, highly effective. So I will demonstrate, I will show you the point here, don't worry. So first, we should understand this concept. Why we are doing moxibustion? What is the purpose? So moxibustion, we are doing the heat treatment we are doing for making our immune system stronger. Means our yang stronger because yang are giving us immunity. So yang gives the defense mechanism. Yang are aggressive, so ready to fight. Yang are making you alert, and yang means fighter. So they are your bodyguard, they are security guard. The yang are your commandos. So suppose this is the person and the person is shielded by the yang defense mechanism. So there's a shield outside. Yang is providing the shield or providing the defense system. So it means if we talk about the immunity, so immunity means the outer defense system. So what is the meaning of poor immunity? The meaning of poor immunity that your condition is like this small kid and you want to fight with this big attacker. So this is the meaning of poor immunity. So COVID-19 become very powerful like this attacker. Because you are having poor yang, poor immunity, but once you do Moxa on the CV6, CV12 and stomach 36, even your small kid will become bigger. Then we'll do the fight. So this moxibustion is for the purpose to ignite the yang energies. And when we talk about this what is inside this moxa stick. This moxa stick, what is the importance of this moxa stick? Inside of this moxa stick, there is a one herb. The name of that is herb is Artemisia vulgaris, and we are using this herb for moxa. So we are drying this herb and we are making in the powder form, and we are filling and making like the stick, and we are doing moxa. Now this is the moxa stand, which I'm going to demonstrate you in the upcoming class. And with the help of this, even you can do the moxivation for 10 minutes, for 15 minutes, and you can make immunity stronger, and you can give a very strong stimulation to any point. Even the moxa, we are doing the moxa on the chakras. So this is for improving the energies in the chakras. So the first point we have stimulated, that is CV6. The CV6 located 2 fingers down from the navel. That is the CV6. The CV6 also called vitamin point. And CV6 is the generator of heat. And another point was CV12. CV12. CV12 is fortune up, or I told you, in the middle of sternum bone and the navel. And the third point is stomach 36. So this is the knee. From the knee, if you go 4 finger down, that is the location of the stomach 36. So with the help of CV6, CV12 and stomach 36, we can improve our this poor fighter, and we can make it stronger just by doing moxivation on these 3 points. So now, the next step. Before doing the treatment, we should know about the enemy, about the attacker. Who is attacker? Who is attacking in your body, and who is making you ill? Who is responsible for the diseases? Until and unless you recognize your attacker, you will not able to do the treatment. So the attackers are these. Now in the next class, we will be discussing about these attackers and how to defend each and every attacker. These are different types of attackers, different types of the disease creators. And these are called 6 evils. 6 evils. Okay, so now we should recognize the 6 evil, and then we should make our immunity stronger. And if some evil has attacked already in the body, then we have to fight and expel it out, right? So enough for today. Now we'll do the class tomorrow, right? When you're doing the moxa, there is many steps of the moxas, right? We have to do the moxa. How much moxa we should do, what precaution we should take, we will discuss in the upcoming class. Because of the time limitation, we cannot discuss everything. But I think even what we have done today, it is going to help you. Okay. It is going to help you. Is it or not? Is it going to help you or not? Moxa can be done for kids as well, right? So now we are doing 2-minute break. अब हम 2 मिनट का ब्रेक करते हैं और फिर हम हिंदी में रिकैप करेंगे. तो हम 2 मिनट का ब्रेक करके हिंदी में रिकैप करेंगे. Now from the tomorrow onwards, the class will be only for enrolled participants. So if anyone is interested to learn whole cupping therapy and acupressure, then welcome to join this class, right? So if anyone wants to join this class, you're most welcome. And if anyone having any questions, even you can, suppose someone want to get the Moxa and anything you want some address, you can message me at this number. Right, this is my number. So you can save this number and you can message me if you want to get anything, right? Thank you so much. Right now, we are just doing online classes because in the pandemic, we have started online classes, but pandemic has gone, but still our mind is not agree. So our mind is still having little pandemic effect. Okay. So maybe 3-4 months, we will keep on doing the class online. After that, we will think about the offline, right? Yes, Rita ji, you want to ask something? Yeah.
सर ये मोक्सा वेरिकोज वेन्स में भी काम लगती है सर?
Excellent. Moxa is the excellent for the varicose vein. I will discuss. Varicose vein is already in our syllabus. Okay, I'm going to discuss.
Yes, sir. And sir, only Wednesday, Tuesday, Monday, Wednesday, and Friday
No,
classes?
no, right now, because see, be as per our discussion, Natasha ji, kindly tell the schedule of class.
Yeah, hi, good evening, everyone. So the schedule would be from Monday to Thursday, Monday, Tuesday, Wednesday, Thursday, and it will be for 15 days.
Yeah, so the class we are going to do Monday to Thursday, and we will finish this class in 15 days. Okay, and after that, we will do any other class. Okay, so first we are going to do this class because first I was thinking to conduct this class 3 days a week, but Natasha ji has already announced this. So now we will do the same. Okay, so there's no problem. We can do some of our other classes after that, after the finishing of this cupping and acupressure course, right? So thank you so much, everyone. Now see you tomorrow on the same time. Closing the session now. This recording also will be available for everyone, means maybe tomorrow morning. Okay, thank you so much. Have a nice day.
Thank you.
Oh, still Hindi session is left. Hindi session is left. So giving the 2-minute break, then we'll come back to the Hindi 2 minute का break करके फिर हम हिंदी में discussion प्रारंभ करेंगे. ठीक है.